guys, Lainey K. Good to sort of see you. Couple things before we get started. Yeah, my hair looks like crap. I just finished cleaning my house and it's growing out and it's kind of wild and unruly, nutty hair. And secondly, I'm sorry about my voice, but if I waited for my voice to get better, we'd have to wait till June. So I want to go ahead and get this done, so just bear with me. What I want to basically talk to y'all today about is the coronavirus. We're going to talk about some basic stuff. Basically, it's a Q&A. I've gotten a ton of questions from y'all, and I felt like this might be the best way to handle it rather than me writing 4,000 bazillion emails. So hopefully these are the most common questions I've gotten, and hopefully you'll find it helpful. First of all, people have asked me, where does COVID-19 comes from? Well, the way that they name any kind of viruses, it's a very set standard the way they do it. So in this case, for example, COVID-19, the CO, COVID, that's coronavirus, the V is for virus, and the D is for disease, and the 19 is the year that it was done, 2019. It's actually caused by the novel coronavirus SARS-CoV-2. So what that is the severe acute respiratory syndrome caused by the coronavirus type 2. Type 1 was the original SARS outbreak back in 2003. I want to tell you first of all, what is a virus? A virus is basically a tiny little particle. It's a parasite, actually. They have their own genetic material, but they're not considered to be alive. They can only live in a host. So what they have to do is they have to actually infect someone in order to survive and in order to reproduce. The way that this coronavirus, sorry, my neighbor. The way that this coronavirus actually reproduces is interesting. The coronavirus looks like a spherical ball, just a ball with all these spikes sticking out. At the end of these spikes, it allows the virus to actually grab on to your own respiratory cells. Then what it does with those spikes is it sticks to it. Now, scientists refer to this virus as being sticky, and what that means is it's very easy for it to attach. For whatever reason, it does it very well. That means that it is actually able to attach to the cells well. It's hard to get it off. They are able to inject their information into our cells, and then when your respiratory cells from then on reproduce, it actually cranks out copies of the coronavirus. Now, this is considered to be particularly sticky because it's very effective at it, and that also is probably one of the reasons why it's more easily passed than some other viruses that we've looked at in the past. Coronaviruses are a family of viruses that cause all kinds of respiratory things. Most of the time, the illnesses that you see are very mild, like common colds are respiratory viruses caused by the coronavirus. Also, just general upper respiratory infections where people end up with bronchitis, but it turns out it's not the flu. A lot of times, they're caused by the coronavirus. Now, coronaviruses can live in humans and they can live in animals. What happens is when an animal virus passes over into the humans. And the reason is because we don't have any protection from that because we haven't been exposed to it. In this case, what they think happened is they think that this actually originated in horseshoe bats. And then that virus went to an intermediary host, which they think in this case was probably a pangolin, which I don't know what it is, but here's a picture of a pangolin so you can see what it looks like. It's basically a scaled anteater. Well, in China, they're actually sold at some of these open air markets. They sell their scales and they sell their meat. So what they think happened was that somebody got infected with this virus when they were handling the meat or handling the scales. They got sick and then they passed it, and that's how this whole thing started. Same thing happened with the original SARS outbreak and with MERS as well. With SARS, it started with a civet cat, was the intermediary host, and then it jumped to humans. And for MERS, it was actually a dromedary camel that jumped to humans. Now, this is kind of interesting. A couple people had asked me, the pandemic flu that they always talk about back in 1918, there was no such thing as air travel then. So how is it that it went all over the world and got everybody sick that way? It actually corresponded exactly with the end of World War I. So what happened was people on the battlefield got sick and then they took it home with them. And so it went to all four corners of the world and everybody got sick. So that's how that spread, even without the benefit, from a virus perspective, of air travel. Now, several people have asked me, has the virus actually mutated? Now, mutation sounds scary. It sounds like what happens is all of a sudden it's become this horrible virus that everybody's going to die and it's going to grow uncontrollably. That's not what mutations are. Generally, mutations are pretty innocuous. They don't usually cause a big problem. What happens is the way that we had talked about it infecting the cell before, when it injects its information into your cells, it's kind of a chaotic process. And as it makes copies of itself, sometimes little things get left out or gets mixed up. And so when that happens, what you end up with is what they call a mutation. Most of the time it doesn't affect cell function. If it does, then it dies off and it never establishes an infection. But if it doesn't, it can be just a little mutation, no big deal, cell still works, still can create disease, not a big deal. But what's interesting is from that point, scientists can actually go back and see, because at that point when that person becomes infected and the weird copy is made, that wonky copy is now what that person will pass on to the next person. So you can actually trace it back to see when it went wonky, and at that point, you know, that was the mutation, and allows you to actually track strains and see where the different ones have ended up. Now, the way that that's been used here is they found that there was a couple of strains that started in China, one that was a little less serious than the other one. The more serious one, unfortunately, is the one that really kind of took off. And then from there, it went to a bunch of different places, but it went to Europe, where some mutations happened there. So the New York outbreak they found is mostly from the European mutations, so it basically came there from Europe. And in Seattle, the people that were infected, it was much closer to one of the original China viruses, so they say that's where that originated. And that's how the mutations work. The other thing you can have is, let's say that you have one person who perhaps worked in this open air market, and they already had a cold, a coronavirus, and the same coronavirus cell and this novel coronavirus tried to invade the same cell. When they did, some of their genetic stuff got mixed up. That's also how a mutation can occur. That can end up where it's easier to pass sometimes, or sometimes it can not work at all, and then it doesn't go any farther and nothing happens. But mutations don't have to be horrible. But what we're looking here is, yes, it has mutated. The good news is it hasn't mutated significantly or quickly. And as a result, any kind of treatments that we get are expected to work on pretty much all the strains that we have. Another question I've gotten is, the numbers from this pandemic are so scary. It basically looks like the disease is spreading like wildfire, and everybody who gets it's going to be fighting for their life in the ICU with not enough ventilators. What is the real deal about the severity of COVID-19? Here's the deal, you guys. The truth is, for most people, first of all, it's not a death sentence. Let me be very clear. For most people, as a matter of fact, it's pretty much a little annoyance. Before we start on this, let me explain to y'all a little bit about how numbers work when it comes to public health type things. In this case, in the US, we've done a terrible job of testing. And we got started late, we've been behind the 8 ball, and then everything exploded, and all we've been doing now is basically trying to catch up. So the problem is, we haven't been testing the community. The only people that have been tested are people that go to the hospital and they're sick. So they test the people who have symptoms only. They aren't testing the general community. So these numbers are completely skewed. Let me give you an example of how this works. Let's say you have a community of 1,000 people, okay? In that 1,000 people, 100 people start to have symptoms of this. So that 100 people get tested. Now, it ends up that 10 of those people end up dying, okay? Now, if you look at it as the whole community of people is 1,000 people, and they only test 100, and 10 people die, the way that the death rates, when they figure it out, is that would be 10 people out of 100 people that were tested died. And that gives you a 10% death rate. Now, let's say you have that same community and you have 1,000 people, and let's say they test the entire community. They test 1,000 people, okay? Let's say they find out that 800 of those people actually are infected. And now that same 10 people die. Well, now the way that works is you divide the 10 people that died by the 800 people that were tested, and now that case fatality rate is down to 1.25%. That's why these numbers are so ridiculous and sound so scary. And every day when you turn on the TV, it's like, oh no, we've got another 15,000 cases, 5,000 cases. It doesn't mean that while we've been sitting at home that everybody's been passing this around more. What it means is they've just discovered people who have already been infected with it before we all went in our houses. So what you're looking at is the numbers as people who are getting sick and are being tested, or now they're starting to test the community. So even people without symptoms are starting to get tests. That's why these numbers look so ridiculous. Now, South Korea did a great job of community testing. They actually identified a ton of people that actually were sick. And the way that they've done their pandemic, the way that they've worked with it is very different from the way we're doing it in the U.S. In the U.S., we've been testing people who are sick because that's all the tests we had. In South Korea, they tested everybody, and when they find somebody who was positive, they would take that person, their family, and all the people they were in contact with, and those people would go into quarantine. And it would be a strict quarantine for 14 days. This way, they didn't have to put the whole community into quarantine. They basically just did the people who were sick and people who had been contacted with those people. So they did it a whole different way. That's what's going to happen with us. In order for us to get out of our house, we have to have a lot of testing. Because what you have to be able to do is test people, and when you see somebody sick, get all their contacts and put all of them in a little bubble instead of putting the entire community in a bubble. That's what we're looking at. The more people that get tested, the higher the numbers climb, but the more accurate the numbers are. Experts are thinking that the death rate on this is probably actually less than 1%, but because it came up so suddenly and all of us were just trying to catch up more than anything, we really don't have a good view as to how many people were actually infected in the community. Now in South Korea, because they did such a great job, their actual death rate was found to be 0.6%. So less than 1% of people died in South Korea. They still had a ton of cases. The thing you got to remember with the numbers also is, let's say 1 million people get infected and you have a 1% 1% death rate. That still is 10,000 people. So you're still talking about huge amounts of people because nobody in this country, nobody in this world already had any kind of immunity to this. So what's happening is when people get sick or exposed to it, a lot of people get sick because they've never fought this off before. That's the problem we're looking at here. This is a numbers game. When everything falls out, this is what experts say they think. About 80 to 82% of us will have zero symptoms or very mild symptoms. Right now in Georgia, we had one day last week, it was 8,000 was the pollen count, which is insane considering that anything over 100 is really high or something. Anyway, the point is, all of us sound crazy. And I have the voice problem. You put the voice problem and allergies together, and I sound like I'm dying from something. 80 to 82% of people will not get sick at all. 15% of people will have illness that requires medical attention, and some of it serious illness. 3% of all people are considered to have critical disease where they have to actually go in the hospital. They may get intubated. They're in the ICU. They're really sick. 3%. Now, only a percentage of those people die. So like I said, if it's 1%, that means 99% of everybody else is going to be fine. So y'all have to remember these numbers are not what they seem to be. Don't let it freak you out. This is interesting. Of that 3% of people who are critical, most of them that died were over 70 years old and or they had underlying conditions such as diabetes, heart disease, high blood pressure, liver problems, kidney problems, lung conditions. Deaths increase significantly as people age, and they increase in younger people who have these, what they call comorbidities, diabetes, high blood pressure, all these other underlying conditions we're talking about. This is kind of interesting in the U.S. They've had significantly more black people that have actually caught coronavirus and have actually died from it. Couple of reasons for it. There's all kinds of societal reasons, less accessibility to care, multi-generational families tend to be living together, that kind of thing, so it passes easier because you're in tighter quarters. But the main problem is that most of the people that died had these comorbidities. Unfortunately, the black population in the United States has a much higher level of kidney disease, heart disease, high blood pressure, and diabetes, and so they were affected disproportionately. You saw this a lot in the people in Louisiana and New Orleans that were affected. Next question I get is, how is coronavirus actually transmitted in the community? Now, most of the times the coronavirus is transmitted by droplets. People talk, they sing, they yell, they holler, they sneeze, they cough, and that generates droplets. How many times have you been talking to somebody and you spit and you're like, oh, sorry? It's the same thing. These droplets are infectious. If another person breathes in those droplets, or it gets in their eyes, nose, or mouth, or it gets on a surface they touch and then touch their eyes, nose, or mouth, it can be transmitted. The best way to prevent transmission is social distancing and to wash your hands. The good news is the virus doesn't jump off of stuff. Like I could put coronavirus all over my hands. It's not going to infect me unless I touch a mucous membrane. or I lick them or something like that. So what we're trying to do is interrupt the transfer, and that prevents cross-contamination. Now, those of us in dentistry get that, but the general public doesn't. I was in line at the grocery store the other day, and this girl had on a mask, which wasn't covering her nose, and she had on gloves. And the gloves, while I was watching her, she stood there and she was touching all her stuff with it, and then she goes like this. It pretty much is of no use to anybody when you do that. We understand that a lot more than the general population, and that's where the problem is coming with this. The other problem is this corona can actually live on surfaces for several days. Scientists tested on various surfaces, various materials, and what they found is it can live on plastic, stainless steel, anything basically hard and solid for 2 to 3 days. It can live on cardboard about 24 hours. It can live on copper for 4 hours. The thing is, it transmits much better on a hard surface. Because think about it, if it's on cardboard, it could be embedded in some of the fibers, and you may not actually come in contact with it if you touch the box. But the other thing is that these will vary under real world conditions. For example, more humidity, temperature, ventilation. Those kind of things can affect how long it can actually live. Some things to make sure that you always wipe down after you touch it, or you've been out in public: your cell phone, your keys. If you go to gas pumps, make sure you use a barrier on the gas pump, or make sure that you clean your hands off very well afterwards. They actually think that's been some transmission issues that they've had here in the area that I live in. A lot of folks have said, well, what do you do like when you get home, or when you come from the grocery store into your car or into your house? And I told them, I said, here's what you got to remember. On all this stuff, you basically want to make your house a safe bubble and your car as safe a bubble as possible, so that once you're in there, if your nose itches, you don't have to worry about scratching it. I had no idea. Actually, I did have an idea how much I touch my face. I'm so itchy all the time. And this time of year, all I'm doing is this. I'm at my own house, by the way. All I've been doing is scratching my eyes, scratching my mouth. My lips itch. It drives me bonkers. So I have to be real careful to make sure that I don't go out in public and I don't break that chain, so that I can't actually transmit anything. If I get groceries, when I go to my car, I open the trunk, I put the things in. Then I come over and I open my door, and when I do, I sit down and I have a hand sanitizer in my cup holder. I pull that out, I put it on my hands, I do my hand sanitizer. Make sure you use a good bit of that stuff, and it should take about 20 seconds until it's actually all evaporated. Once it does, then I shut my door and get in my car. I put on my seatbelt, I turn the car on, that kind of thing, and I touch the steering wheel. That way I don't have to worry about contaminating the inside of the car. Only thing that's contaminated there is the outside of my hand sanitizer bottle. Then when I get home, I bring the groceries in, I go into my kitchen, I stick it on one place on the counter, I take everything out of the bags, I throw the bags away, then I wash my hands, then I take a wipe, then I wipe all my groceries down and let them dry. Once they dry, and then I wash my hands, because you're using a wipe and that stuff isn't real good for your skin. Then I put everything away. Then once everything's off my counter, I sanitize it, and then I wipe my doorknobs and anything that I touch coming in that I may have touched with contaminated hands. And now I'm in my house. It's not contaminated and I don't have to worry about it. Same things if you get boxes from UPS. A lot of people have been freaking about that. If you get a cardboard box from UPS, bring your package in, put it in one set place, open it up, take all the stuff out, take your trash out, throw the boxes away, come back in, wash your hands, wipe down everything, and then wipe the stuff, wash your hands again, because you want to get all the chemicals off of your hands. Then, by the time that stuff's dried, you can put it away, you decontaminate your counter, and once again, you don't have to worry about it. Make sure you hit the doorknobs and all that stuff that you may have gone with your contaminated boxes. But by doing all that, you're keeping your little bubble safe. And then you can do whatever you want when you're in your house. That's what we're trying to do. Food containers. Just to let you know, there's been no indication there's any transmission from food. Now, of course, they're plastic containers, so stuff can live on the outside of those. So do the same thing. Unpack them on the counter, put them on a plate, decontaminate everything, wash your hands, blah, blah, blah. The point is that it's a lot of hand washing, but that's not something we're not used to, so it's not a big deal. But again, you're in a bubble now that is not potentially infectious, and you don't have to worry about passing that stuff back and forth or getting unintentionally inoculated with this pathogen, not meaning to. This was an interesting question. Somebody asked me, they said, why are the experts hesitant to have people wear masks in public? I really don't see what the downside is. The biggest reason when it comes to the general public is the general public is not very educated. And I have to say, after watching all this, I totally get that. They really don't know anything about disease transmission. They don't realize that the mask actually just reduce, not eliminate any kind of risk of transmission. And they also don't realize they're more helpful to protect others than to protect themselves. So what happens is a lot of people who wear masks actually will disregard social distancing. They'll figure, I got a mask on, I can hang out with my friends, I can do all these other things. They touch their faces a lot trying to adjust the mask, and you actually can end up doing more harm than good. So that's what the deal was with the masks. Another question is how do we have to worry about this? How is it transmitted in the dental office? The first thing that we got to know is it's important to screen patients to make sure that we keep people with any symptoms out. One thing that they have recognized, they do think that the more virus you're exposed to at one time, the more likely it is that you're going to get sick and the worse you're going to be sick. That's why they think some of these healthcare workers have had such severe illness, even though they're generally in good health and don't have a lot of these comorbidities we were talking about. They're constantly immersed in that stuff. So it's important for us, especially because we don't have the respiratory protection that they have in these hospitals, it's important for us to make sure that we isolate ourselves as much as possible from the infection. So screen your patients, make sure they're not coughing, make sure they don't have any fever, make sure they don't have pink eyes, which they found has been one of the symptoms. Some people have lost their sense of smell, their sense of taste, which is kind of interesting. The problem is up to 80% of people are not symptomatic or have such mild symptoms that we would think it's just, like I said, like allergies or a mild cold. So we do have some risk. Once you're there, once the patient comes in, make sure that your front desk person is isolated well enough from them. Your front desk person, either some offices are putting up plexiglass barriers to prevent any kind of infectious droplets, but the truth is there's other ways that you can do it. If there's a way you can rearrange your front desk to give yourself distance of more than 6 feet, what we did is we actually moved our credit card machine over to another counter that has another part of the counter that they can actually access, and by doing that it put them like 8 feet away from our front desk person. She still wears a mask and eye protection, or will once she comes back, but that way she's isolated from it. If they have to get any closer, just make sure they wear eye protection and a mask. Our mask worked fine for general just droplets and speaking to people, and especially because we don't generally have long contact with people standing at the front desk. But anyway, make sure that you make your front desk as safe as possible for those folks. The biggest problem that we have with all this is we don't have adequate respiratory protection in the back. In the hospitals, they have the reverse airflow, so actually all the infected air is sucked out, for lack of a better term. So we don't have any of that, so we have no respiratory protection. Now, we do a lot of things well. For example, our suction that we use, our high-speed suction, actually does a pretty good job of getting a lot of aerosol out. We generally wear eye protections and masks. That also protects us very well from droplets. Doesn't protect us that well from aerosol. So most of us do not have respirator level mask. And I don't know about y'all, but starting in January, I couldn't get any mask other than level 1. Every time I'd order level 3s, they would send me level 1s. So I got tons of those. I can do a lot of exams, at a good distance. But I really, as far as what we need when we're doing any kind of procedure that generates droplets or aerosol, most of us don't have what we need. In the past, you got to remember what our entire standard precautions are geared towards is preventing the transmission of bloodborne pathogens. Our stuff works great for that. We weren't really worried that much about respiratory stuff with aerosol. And the reason is we don't generally work on those patients. The type of things that you have to have respiratory protection for are TB, which we don't treat, active tuberculosis patients. Ebola. You got somebody bleeding from various orifices, they really don't need to be in our office. We don't have to worry about that stuff generally. The only thing we really had to worry about before as exposure goes was really the flu. And honestly, most of us are not that afraid of the flu. Most of us take flu shots, which decreases your symptoms and lack of getting sick significantly. They found that people that take flu shots regularly through the years, even if they miss, like they periodically do when they try to guess which strains to actually put in the vaccine, even when they miss, They found that still you have some protection because you were probably exposed to a similar virus before in either the vaccine or you got it, and so you still have some protection. People who take flu shots are much less likely to be hospitalized or to have serious disease. So even if you think a flu shot doesn't help because you got the flu, it actually has helped quite a bit. So you got to keep that in mind. We also have Tamiflu and other antiviral treatments that can help reduce the amount of virus and get you over this quicker. As a result, most of us really aren't that scared of the flu. Also, in dentistry, we all have pretty great immune systems because we've been exposed to everything. Think about it. Everybody that comes in is 18 inches away from your face. So we're exposed to all kinds of stuff. In retrospect, we should have been more careful because this, of course, could have happened and did happen. But the reality is this something that on a daily basis we weren't worried about. We protected ourselves very well from bloodborne pathogens. Now we've got to start protecting ourselves from respiratory. I've had several people ask me about external suctions or UV light. Would that be a good thing to add to the office? Sure. Because the less pathogens that you have in your operatories and in your office, the better for anybody, just because who wants to be breathing in that crud? That being said, even though aerosol can transmit various diseases, it's generally not an efficient method of transmission. They actually think that most people get it from droplets. So if you're doing a prophy, all the water that's splashing up is probably more of a worry than the aerosol. The aerosol doesn't transmit as effectively. Can it transmit? Absolutely, and it's something that we need to pay attention to. Once again, our problem is we don't have level 9 N95 masks, and really a lot of us don't have any surgical masks right now. I think I have one box, so it's really not that helpful. They say the new guidelines that came out from the CDC basically said if you don't have at least a surgical level mask, a level 3 mask, plus a face shield, you really don't be needing to do procedures on patients. So we need better than adequate protection. Now, the UV light thing, it kills stuff that's in the air as it circulates through your air conditioner, which is great. The external suction, in addition to your high-speed suction, absolutely anything that you can reduce the level of pathogens helps. But it doesn't completely eradicate the risk. We still have to worry about our PPE. Let's see. Oh, a lot of people have asked me about do our other procedures, are they done sufficiently? Like, the way that anything that goes in the mouth is sterilized or thrown away. All of our surfaces are disinfected with tuberculocidal level disinfectants. All those procedures are absolutely fine. We don't have to worry about that causing any kind of problems. A lot of folks have asked me, are our disinfectants that we use sufficient to kill this coronavirus? And the answer is yes. This coronavirus, like we said, is basically a fatty outer layer, and then all its genetic material, which is an RNA type, is inside that fatty layer. Well, that fatty layer can basically be penetrated by pretty much any of the disinfectants we use, and ordinary soap, by the way. It breaks it up and it kills the cell. So any of our disinfectants are generally fine. There is no evidence that this coronavirus is different from any other coronavirus in that respect, so it shouldn't be easy to kill. A lot of people had asked me about Cavicide. Cavicide was not originally on the emerging pathogens list. It is now. I think I checked it the other day. Here's the thing about emerging pathogens list. These are basically disinfectants that have gone through testing on other difficult pathogens to make sure that they're strong enough to kill the stuff that needs to be killed when you're talking about a new germ that we really don't know anything about. The problem is, in order to say that you can kill against that specific pathogen, you have to test it against that specific pathogen. And a lot of times you can't get it. For example, it isn't like you can go to Shine and order you up some MERS or some SARS so that you can play with it to see if your disinfectant works. That's not what we need to have done. So what they do is they test it on things like tuberculosis or norovirus, or they also make sure that they do include these coronaviruses, and as long as it kills all those things, it should kill the stuff that we're worried about. Here's what's interesting. A lot of the disinfectants on the list, on the emerging pathogens list, are not considered strong enough for us. For example, regular Lysol spray is on the emerging pathogens list as being effective against this pathogen. We can't use it in our office because it won't kill tuberculosis. We have to use the professional spray, which will give a tuberculosis kill in 10 minutes of contact. So trust me when I tell you, the stuff that we've got, as long as it kills coronaviruses, they expect it'll be able to do this. As long as it's tuberculocidal, it should be able to do this. Even the EPA, let me read you what they actually said. They said that you can be on the ones that have been approved for use against SARS-CoV-2 have not been tested against it, but they're expected to be effective based on efficacy against a harder to kill virus like tuberculosis, qualified for the emerging viral pathogens claim, or demonstrated efficacy against another human coronavirus. So basically, if it kills another human coronavirus, you're fine. The other thing, if you look at the list that are the ones that are on the emerging pathogens list, what's interesting is a lot of them are very harsh. A lot of them contain bleach. You know, we can't use bleach on a lot of our equipment, and if you use it on your chairs, a lot of times it'll actually void your warranty. So make sure that you check that out too if you decide that you want to use something that's specifically on there. But like I said, I did check Cavicide, it's on there. Lysol commercial spray is on there. So just make sure that you have something tuberculocidal. It should take care of this. This was an interesting question. I had a couple people last week that asked me, can you be reinfected with the coronavirus? There have been people that tested negative after they'd been sick, and then they tested positive later, and they were wondering, can we get it again? Experts do think that you get immunity once you actually get this disease. They do think that you've got protection. They just don't know how long the protection lasts. Most of the instances, though, where people actually tested positive after they tested negative, they thought was more of a testing problem. I don't know if you've seen how they do the test, but I swear they stick a Q-tip about up to your brain and have to get a sample from up there. And the problem is they said that a lot of people don't do it sufficiently. And so some of the samples they've had are actually bad. They think that's probably what happened on that. The other problem you can get is even on the best test, you're going to have some false positives and false negatives. So they may have been falsely negative. In some people, they also think that what may have happened is the virus may have reactivated in the body. Meant they were pretty much over it, almost over it, but then something happened and their immune system wasn't quite containing as well as it should, and it popped back up, whereas it looked like it was gone. It wasn't actually gone. You also may have those weird situations where you're always going to have some odd person that could be reinfected. My mom got chickenpox as a kid, and then she got chickenpox as an adult as well. That almost never happens. People rarely are infected with chickenpox twice. She has some autoimmune problems and that kind of thing. I have a feeling that her immune system just doesn't contain stuff the way it should. Probably doesn't fight back on things the way it should as well. Regardless, experts feel that if they are going to get reinfected, if somebody does actually somehow get reinfected, they feel that the disease will be much less. And we talked about that with the flu shots. When you take a flu shot, and even if you actually get the flu, you'll get a much less severe case than you probably would have if you'd actually been infected. So it's actually very effective that way. The last question everybody keeps asking me is, when do I think we're going to go back to work? I got no idea. I wish I did know, because I'd be making some money in the stock market, but nobody really knows. Unfortunately, the experts that I've spoken to, I know some folks in the CDC and that do some research around, and they say they don't think we've even are really close to the peak. They think that probably we won't hit the peak of this until about mid-May, and if it's mid-May, it's not like we're going to come out and a week later and everybody's going to come out of their houses and figure everything's fine. So I just don't know. The thing we don't want to do is let everybody out too soon, have this huge outbreak, then everybody's back in their house again for 3 months. Here's what we need to have. We need to have proper masks. We need to have correct personal protective equipment. One thing I do want to tell you about masks, I'm glad I thought about this, is there have been a lot of counterfeit N95 and respirator masks on the market, so be very careful where you buy them from. You can find things on the internet where they tell you how to test if the mask is actually effective to make sure that you're not getting screwed over and we're getting something that's just paper or something completely useless. So be careful about that. The one thing that all experts agree on is we have to have widespread testing before we can go back. We have to know who's actually been infected and who hasn't. Once we can test widely, we can actually see who has not been sick yet, and if those people get sick, isolate them quickly, isolate them with all their contacts, and then the rest of us can go back to work. Also, they just have a test that was approved where they can test antibodies to see if you've already had it. That's going to be really important for folks like us. A lot of people think that those that work with the public like we do, and people that work in stores and grocery stores and are this far away from people all the time, a lot of us have probably already had this and didn't realize it, or have already built up immunity because we've been exposed enough that even if we didn't get sick, we've built up antibodies so that we're safe from it. Once we know that, then all the people that have antibodies can go back to work. You don't have to worry about those folks either. Remember, the way that a pandemic ends is basically when enough people have either gotten it or gotten a vaccine so that everybody else is safe. Once you achieve what they call herd immunity, enough people are actually safe and not susceptible so that it can't pass easily in the community, then what you have is basically you'll have little pockets of it jump up here and there. But those are easily contained, they're easily taken care of by our healthcare folks, and they won't overwhelm the health system. The problem is, since we don't have antivirals to work against this, and we really don't have any effective treatments for those who are really sick, you can't just let people out and let them go willy-nilly, because people who get infected can die. So we have to be careful of it. There are several rapid tests that have been approved. Once those become widespread, we can test ourselves every week, however many days at times a week they say we should be tested. We can even test our patients on somebody that you're doing something where you're going to generate aerosol. There's all kinds of things that we could do once testing is available to more than those who are sick. Until we know some of these answers, there's really nothing we can do. I would be very surprised if we're back at work in May. I really would. I hope I'm wrong, but I'd be really surprised. And other than that, I hope y'all are having a good time at home. We've had every project done. My husband has changed the oil on every piece of equipment that we have. And our neighbors have, I think. He's been very busy. I think finally now everything's calmed down enough for me that I can actually start writing my trashy romance novels again. So if you're bored and want something to read, there you go. Other than that, I hope y'all stay safe. And if y'all have any questions, please email me. You can see from my voice today why it is that I don't do phone work very much anymore, or live speaking. This is actually a pretty good day during allergy season. I hope you guys are safe and well, and have a great day.